Good evening, everyone. I'm Logan Golansky, one of the members of the Policy and Advocacy Recruitment Work Group, and tonight we are thrilled to welcome Dr. Denise Asafu-Agye as the next speaker in the PARS Fireside Chat series. Dr. Asafu-Agye is an assistant professor of urology at the Loyola University Chicago Stritch School of Medicine, where she has a dual appointment as the director of the Male Reproductive Medicine Department and also in the Parkinson School of Health Sciences and Public Health. She was also named the Gallagher Health Policy Scholar of the AUA in 2023 and is a member of the AUA's Legislative Affairs Committee. She's chair of the Diversity, Equity, and Inclusion Committee for the SMSNA and serves as the AUA's inaugural Diversity and Inclusion Committee member as well. She's passionate about health policy education and awareness, mentorship, and utilizing clinical research to improve healthcare systems access to equitable, high-quality care, and we are so excited to have her today. So with that, I will turn it over to Dr. Asafu-Agye.
Hey, well, thank you so much, Dr. Golansky, who is also very much a leader in the advocacy space and rising star. I'm honored to, have be invited to the fireside chat to kind of talk about why we need to hopefully galvanize everyone behind health policy education as we continue to really be advocates for, our patients. And so I'm hoping that tonight's discussion hopefully get some people a bit more interested and gives, further insight into as to why this is such an integral part, or should be an integral part of our clinical practice, research practice, et cetera. I think you did such a great job with my intro, so I don't have to do any more discussions there, but I was going to talk a bit about the health policy curriculum I put together. I had a generous grant from the Society of Academic Urologists when I was a resident, actually. And then, fast forward kind of post-peri-COVID times, was able to finally publish it. And I think this was something that was near and dear to my heart, because I think that oftentimes, we're like, everyone should be involved in advocacy, everyone should do this, but it's surprising and shocking how many people in healthcare, physicians in particular, do not know how the healthcare system works. We don't know various functions, different stakeholders. And I think even though the assumption is that we should, I think people are really surprised to see that it, at least certainly when I was in medical school, it was not any reasonable part of our curriculum. So when I was in residency, at that time, I had already had my master's in public health. I minored in healthcare policy and management when I was at college at Carnegie Mellon. And so I kind of had this road where I had kind of progressively had more exposure, had more education in the space, and I think recognized the significance behind that. So I think the kind of logic or the drive behind proposing a health policy course for residents specifically was thinking about, if we don't educate people early on the system, there's no way that we can expect people to become interested in this space later. And this has, kind of numerous ramifications when you think about how we advocate for our patients, how we advocate for our specialty, how we advocate for our research. And so I thought it was really just kind of that missing link where, everyone doesn't need to have a master's in public health, but everyone needs to at least have enough working knowledge to say, how does a system work? What aspects of the system am I potentially interested in that I can have an impact, and what aspects, or kind of what are the leaky parts of, the system that really do need more of our support. So when I thought about structuring kind of this e-curriculum one, I was like, well, this has to be, electronic and something, easy, kind of on the go, or residents won't do it, neither will physicians, but something that really thought about like the basics. So I think it really wasn't meant to kind of replace doing a full-on, MPH, but it was really meant to almost be like a primer as to, okay, this is, bird's eye view. This is the system. These are all the moving parts. And then, I think some practical things are thinking about, how do you write a health policy, memo? What are kind of the basic components of that? When we think about how we communicate with our Congress people, if we wanted to actually pitch a bill, like what is a bill even, right? Where does that go? So I think the basics of that are just really key. And again, I think it's, unfortunate that we don't get as much education. I think, even dating back to kind of the late 90s, where we started to see this a little bit more with some internal medicine programs. One that stands out to me, one of the earliest ones was at George Washington University, where they were actually kind of incorporating this a bit more into the medical school curriculum. But then you also saw this with the emergency medicine program. And so I think outside of urology, other specialties, perhaps those that interface with kind of wider echelons of the population, have done this a bit more on the specialty side. But certainly in urology, when we look at even our, kind of requirements to get out of residency, there really isn't a component there. And I think it's something that I would love to see kind of, again, be incorporated more. So I think I just was aiming for the basics when it came to it. And a part of the curriculum also includes, not only where physicians have been involved in the Congress, there have been very few and far in between. We look at all of the different Congresses, the 100+ years that it's been in existence, right? There really haven't been a lot of physicians, certainly not a lot of urologists, was one currently, in the Congress, but very few of us. And so I think understanding where we can have a place and a role is important, because I think oftentimes we don't feel we can have a role, right? Everyone went to med school because we all want to take care of patients, and that's what our focus is. But we are not in a silo. And I think that increasingly we are realizing that we unfortunately can't just focus on our clinical work, because all of these systemic components significantly impact how we carry out our work. So I think, certainly we can even, make that link available either at the end of this or, send that out. But I think hopefully this can serve as a helpful resource just to get anyone started. And although the goal of the initial kind of course is really thinking about residents, I think there are a lot of people at even my attending level who also really don't know different components of the system. So I think there certainly is room for, if you're not just a trainee, to also, gain some knowledge here. And I think kind of in an organized way that I think makes sense for people that are just trying to gain their footing.
Absolutely. I mean, I think that your e-curriculum is an amazing resource. For those who haven't done it, I strongly encourage, and we'll certainly send the link out after this. But, the way that you break it down, it's talking about healthcare systems, physician payment structures, and then the politics of healthcare. I think is really useful because, as you said, I mean, this is complex stuff. Even as people who work within this system every day, it's hard to know the difference between an ACO and a PPO and an HMO, all of these things. And we have to have some common knowledge of that if we're going to be able to have a seat at the table and advocate about it. Something that you said just now that I didn't know is that you started all of this as a resident. And I think that's amazing, as, this is a group of mostly med students and residents that you're speaking to tonight. And, the health policy work to me is like really the great equalizer. So much of our medical education is so hierarchical, and it takes years and years to become a urologist, and you feel like you never quite arrive because you're always doing the next step, and there's always someone who knows more than you. But I think that's amazing that you're able to do such an impactful thing as a resident, before you had finished your training. How did you first get involved in the work? And, who kind of, was there anyone that shepherded you along, or how did you kind of go for it as a resident while you were still in training?
Yeah. So I think, the SAU, certainly has, research grants that you can apply for as a resident. And I think that, like with anything research related, someone needs to pay for your time or your interest, right? And so I think that once I saw that opportunity, I certainly got encouragement, for my program. Luckily at Columbia, we had a research year. So we had time to kind of, apply and kind of get this started. But I think when you're frustrated enough about the system, I think that's what really sparks a lot of ideas, when you have just that extra prior authorization, or if you have that patient that just took way too long to get through the system. I think for me, I was just recognizing more and more like people don't get it. And I was coming from a lens of, having that public health background. And so it was just like this constant, trigger, like if we knew this, that this can happen. It's like, why are we fighting for this? And so I think that when I recognize, well, if we just have an entire generation of people that don't know the system, we are going to continue to not have seats at the table. We are going to continue to not be able to effectively advocate for urological issues and our patients. And so I think that for me was a driver. And it's funny because, you talk about the kind of great equalizer, you attend, awesome conferences like the AUA Summit. And for me, my first summit was during my research year when I was doing all this. And so I almost just didn't even know there was like an entire swath of urologists who cared about this. I think oftentimes I'm just like, okay, probably only public health people care, or, maybe some other physicians, but it's so important to really kind of band together by specialty, because there are certain nuances, certain things that really just a urologist may get, or things that are kind of unique to our specialty. And so I think that when I was considering how I want to frame this, I really wanted it to be, okay, how can we still center this on it being urology, and how do we get, kind of urologists involved in this? And so I think I got a lot of support, and honestly, attending the summit was really the full circle moment for me. I met a lot of still my, current mentors, Dr. Reed, Dr. Rex Chapin, Dr. McNeil, and people who recognize kind of my passion in this. But I think education for me was just so clear. And so I think that was a big push.
Absolutely. And you mentioned that you got an MPH and that was sort of part of your educational background. And we've talked a bit about the curriculum development and how there were some other people behind the scenes, but could you share a little bit more about how you created such a professional and, honestly, very cool product in your curriculum?
Yeah. So I think once I started to think about kind of the structure of what would, if anyone just wanted to have a primer on this, what were kind of the essential components. I also had to do my research, although I had, the background and training, I kind of consulted what was the kind of breakdown of how I got the basics of even, my MPH, where you have to understand not only the healthcare system, social determinants of health, we're doing stats. And so I just had to think about, if someone never went to go on and get, an MPH, what are the skills and skill sets that they would need? And so I think I also had to do a deep dive, to kind of look at, okay, if we're targeting residents and trainees, right, what practically speaking do they need to learn, right? They don't need to know super, things that are terribly in depth, but at least be aware of it so that they can even, think about, okay, let me research on this later. Let me look on this later. And so I think I kind of leveraged how I was trained, so to speak, my MPH, to think about what were kind of those, salient points. I did partner with an instructional designer, which I think was really cool. And I really recommend it for anyone that's interested in education, because it's important for you to think about, how do you kind of chunk the material so that it's digestible, understandable, and interesting. The e-curriculum has, some video components, interactive components, because I didn't want it to just be like a PowerPoint lecture that people were just, clicking through. When you think about kind of different principles around knowledge retention, keeping an interested learner, those are things I also had to actively think about. And I was an active part of that design process, really from beginning to end. So I kind of did all the content. And that for me was the easy part. But then it was just like, okay, if I was a resident, how long would I realistically sit through like a module? Is it something I can do on the go? Because you can make a great curriculum, but if no one is going to sit down and actually get through it, that's also useless. So I was really intent on like really paring it down to essential points, but I did want it to be interactive. And this was also through the guidance of the instructional designer I partnered with, because it was just like, okay, you want people to actually go through this. You want every kind of module to build upon the prior one, that someone completed. And then we also, of course, included some questions, because, humans, resident, it's just like, all right, a question, everyone gets excited. And so I was really intentional about that. And so, yeah, that's how it came about. I think I was really fortunate to partner with someone who had done some work in some other kind of educational spaces. So I think really got it, but then also educated me on, okay, that's too long, or no one is gonna, get through that, or like Do they really need to know, like, all of the subcommittees of, Congress? Probably not, but they need to maybe know that it exists. So I think I really had to pare down kind of, heavy material. And again, for those that are more interested, this was really a starting point. And so whether you want to go on and formally do an MPH, a Master's in Public Policy, which I've also seen some people do, I think it's important just to kind of see where that, interest lies. So that's how we came to the current course you see in plan.
And that partnership with the instructional educator, was that something that you developed at Columbia? Was it through your work with the MPH at Harvard? How did you get connected with that kind of person? I feel like medicine can be such a bubble that we don't know these resources even exist.
Yeah. So it was actually kind of challenging. So I think I actually got paired up with him through word of mouth. It was really just searching because every actually university does actually have a band of instructional designers, so if you're in college, med school, every course you're taking actually has like an instructional design team. Because I was doing this in the context of a grant, I had to actually look externally because I couldn't really like afford the cost of what the instructional designer at a university level probably would have charged me for this really kind of small, like mini course. But I researched and kind of interviewed actually several people before I, finalized on the one that I partnered with. But it was seeing prior work and also someone who had worked with someone in medicine, right? Because I think there's a lot of different things and, models that people can put together. But I think our content is a little more dense. And I think thinking about kind of the very short attention span of, a fatigued resident was something that was also top of mind for me. So I needed someone who really kind of got I didn't want it to be something that was like super flashy, kind of the right balance of engagement, professional, and something that I think could also kind of stand the test of time so that if, someone picks up this course and, 4 or 5 years, most of that content is still going to be kind of true, maybe different ways of getting involved in advocacy. There may be kind of other updated opportunities, but for the most part, the structure of our health system, how to write a memo, what are those components or things like that, how we're paid. Those generally are, I think, kind of the core building blocks that everyone should really know.
Absolutely. In terms of, medical education and developing the curriculum and kind of condensing, like you said, these sort of massive topics into something that's digestible, what were, maybe the top one or two lessons learned as you went through the process of developing the curriculum for people who maybe are interested in doing some medical education of their own?
Yeah. So I think that especially just the structure of the healthcare system is really key because I think now with there being even more and more kind of healthcare professionals and it's really important to kind of see, well, where do physicians fall in that in that space? Where do medical students fall in that space, right? And so I think you sometimes don't even appreciate what are even considered healthcare points of access, like things that don't really kind of register to you or things that people aren't exposed to. And so I think if I had to add any kind of essential class to even every medical school, just the structure of the healthcare system, because I think particularly when you are at an academic medical center, I think you sometimes have a little bit of a skewed view of how like what the healthcare system is comprised of, right? Unless you know a physician, even thinking about the structure of our private practice physicians, private groups, et cetera, you almost are just not really aware of that because all the medical schools are congregated around, big academic medical centers. So I think it's really important too to kind of open people's eyes. When you practice, for example, most healthcare is actually like not in an academic medical center, right? There's not many of us. And so I think particularly when you understand some of the challenges and how the system is set up and all of the players, that's the only way you can really kind of think about, well, how can I enact change? But if you are siloed into thinking that, all of medicine is just, your academic medical center or, kind of your, big, kind of hospitals, I think it does us a disservice because I think there are kind of unique challenges and opportunities that are available at kind of non-academic medical centers and setups and, thinking about like who all is there, like kind of the biome of the patient, right? So the patient comes to see us on like one part of their healthcare system, biome. and they're interacting with so many people, and I just don't think we grasp that fully. And unfortunately, then when you get to training and then when you get into practice, you're more and more exposed. And I just think that early on you anticipate this and you kind of know who those players are. I think it allows for kind of better collaborations, better dialogue as we continue to progress through the system.
Absolutely. And, I think that exactly just what you said at the end there and what you mentioned earlier, how one of your sort of impetus points for doing this work was just seeing how the healthcare system was not really meeting the needs of patients. I mean, I think we've all had the experience of seeing someone who's been shuffled around, hasn't been able to get the care they need, and then they come in through the emergency room and something that could have been taken care of, and maybe even prevented has now become a big problem. We see that in urology a lot. Take the person who had hematuria, got shuffled around, and now they're coming in with, cancer and needing, real significant treatment for that. I feel like being at the summit is something that has kind of been one of my points of combining these worlds and then bringing it back to clinical practice. Especially with things that people like Ben Procros or Rushi Talwar from this group have done with drug pricing. Bringing those resources back to patients has been a way that I've sort of seen these two worlds come together for me. As you've progressed in your career from resident to fellow to attending and doing this education and all the other policy work that you've done, how has it impacted your clinical practice? What are the sort of main takeaways that you bring to your patients, like you were saying, with more informed discussions?
Yeah. So I think you just realize if we are not well informed, we just can't advocate for our patients, right? Within my subspecialty that really does benefit from resources like telehealth, you recognize if we don't, for example, continue to advocate for continued coverage of telehealth. I have so many patients here in the Midwest who like can't get to, my clinic for, a myriad of reasons. And if you think about if we don't like see that in real time, like there's some patient like, doc, I would have seen you 6 months ago, but like I literally couldn't get a ride to you, right? Like that is a very real story for a lot of people. And I just think when you see those kind of patient instances, for example, it's frustrating because you know that one is as you're aware, there's not a lot of urologists. It's already hard to come in and see us. We now have at least some kind of outlet where we can still engage with patients even if they can't come in. But you recognize, like, if we were to lose funding, for example, funding to cover telehealth visits, those are tens of millions of patients who literally would now like just not have a urologist, right? And it's just like even if they still can't come in, at least being able to talk to me on video and me being able to do things, remotely and having patients do what they can locally is so impactful for these patients. So I just think when we go to, events like a summit and we come back to clinical practice, you just really realize the impact and so many people are positively impacted by just having the option of not having to come and navigate the difficulties of transportation, money to get there, all of these kind of social factors that we don't consider when we're just like, well, they didn't come for their visit. Or when I think about, even taking a step outside of just patients, right? Like I am a researcher and that's also my world. I think about, well, if we also don't advocate to maintain research dollars, how are we going to find out more information that again goes back to benefiting patients, goes back to benefiting healthcare? So there are so many different avenues of, policy. I think, the payment side, both for the physicians and just even how patients are paying for healthcare. I think that it's also important for people to see we are not just the only thing that Congress cares about, right? We're like one of many areas that have to get funded. And so if we're not thinking about how is this happening efficiently, how is this happening with kind of in a high quality fashion, it really just it serves to really put us at a disadvantage when we think about just having a healthy kind of population, right? So it really should be everyone should be, I think, equally invested in us having kind of a well-functioning system. But I just think that I've really been able to every time I go to the summit, there's like just something else where you go back to your clinic and you see the real-time effects of things that are in place versus things that are not in place. And I think it actually gives me more motivation to just, kind of keep fighting. Because, if we don't, we're just going to continue to widen the gap, worsen the access. And that's something that I'm vehemently, hopefully with all these efforts, trying to mitigate.
Definitely. And I mean, telehealth is such a timely example of something that Congress is literally working on right now so that it doesn't expire in, what is it, 21 days? Just when it'll lapse. And so, absolutely, those are things that, we know from our summit work that the urologists are some of the highest utilizers of telehealth, and it's been hugely impactful for patients. And I think as well, going to the summit, something that we talk about there is that, the people who attend that conference do have sort of this extra interest in health policy and advocacy, but really anyone who's taking care of patients has a stake in the game, and has skin in the game, and should be something that all physicians should be involved in. And so, I do appreciate that your curriculum is really geared towards anyone who's involved in patient care.
Including the patients.
Yeah, including the patients.
Yeah, they're an active, component. And I think, patients are so appreciative when they realize that physicians actually care about, their experience. I think oftentimes, and quite honestly, a lot of physicians really don't recognize that experience, right? It's just like, okay, my experience is you're coming to see me in the office, but on the other side of it, it could be, Joe Smith who had to save up money to get the Uber or to come to the visit, who couldn't get your labs because, his insurance decided that they're not going to fund that. That's a very real thing in like my fertility space. And so I think, it's really heartwarming and motivating to see patients at our summit too. And these patient advocacy groups are, just fantastic. And I think there also is a role there for physicians to be engaged with those advocacy groups as well. Those tend to be kind of more centered around like disease, conditions, but I think our patient advocacy groups certainly do also strengthen a lot of our advocacy efforts. So big shout out to them as well.
Yeah, absolutely. I mean, the summit has really increased involvement with the advocacy groups over the last few years, and it's been a wonderful contribution to kind of the programming. And honestly, I've learned so much from them. I do want to give our participants here an opportunity to ask questions as well. So if anyone has any questions for Dr. Asafu Ajay, please feel free to put them in the chat. But while we wait for people to submit some of those, something that you and I have both had the opportunity to do is participate through some of the AUA's fellowship programming. I know you did the Gallagher Health Policy Scholar program a year ago. Can you talk a little bit about what that was like and what you did in that year?
Yeah. So the Gallagher Fellowship was one of the most kind of impactful experiences I've had in my training and with my career by far. And I think it was just this unique immersion into kind of health policy as a urologist. I think I had already had I would say the framework of, okay, I know the healthcare system works. I know how different organizations function, but now as a urologist, personalizing that advocacy experience. I think you really saw how that was happening on our level. I think I really had interesting exposure around kind of different aspects that I wasn't particularly exposed to or like maybe had a personal interest in, but are vital components of how we carry out our care, whether it's like, the ROC committee and how we're thinking about, all the procedures we do, how those are valued, thinking about the role of the AMA and how that plays a role in kind of, uniting kind of different, physician groups, the patient advocacy groups, where they play a role, how we collaborate with other, surgical specialties, other specialties. So it was really cool just to see there's actually so much more that you even recognize than just okay, you can go, get a bill, connect with your local congressperson, advocate for your favorite issue, but really the organized fashion of advocacy. I really had an amazing kind of internal view about how that was happening on the AU level. And I'm so grateful for that experience. Dr. Ree was the Public Policy Council chair during my Gallagher year and was also my mentor. We were able to meet regularly and, really just kind of, again, getting his insights around, okay, what are all of the different pieces that are, kind of make up all of AUA's health, kind of policy and public policy agenda. And I think you really have to understand how all of these players are part of the picture because sometimes, even as, again, I'm a researcher, I'm like, okay, I care about research dollars and I probably care about things that pertain to the clinical conditions that I treat, but they're all interconnected. And so I think the Gallagher Fellowship, you really did see that network of how everything is connected when we think about our advocacy efforts. Granted, at that time, also being a part of the Legislative Affairs Committee, I at least had, some insight there, but I really think that that kind of full circle moment at what really allowed everything to kind of click were the different experiences I had, as a Gallagher Fellow, being, involved, was even helping with the summit the year I was doing it, and then just meeting just awesome, mentors, friends, through that process. I think within our space, I kind of call us the policy family, right? Like I think for those of us that really are like, this is my baby. I think it's really nice to feel like you found, your people when it comes to this. And I think for me, that's what just this kind of continuity has been. And even with the different aspects of public policy, I think it's nice to be around people who get it, but then also thinking about how do we get like everyone to like really think this is, awesome work and impactful work.
Yeah, I totally agree. I mean, the Gallagher and the whole crew experiences are really, special ways to get involved and sort of see the behind the scenes. And it's my experience as well was phenomenal, and it's so great to hear about yours. Seeing that kind of interconnectedness that you talked about, and now that your curriculum's been around for several years, any sort of next steps you have for the project, or what you want to do next in educating around health policy to get more people on board?
Yeah. So I think outside of, now that of course, this is a group you also, help to, start just resident involvement and having kind of an organized committee around, health policy. I would love to see this become kind of a core area of residency education, because I think even if we can't necessarily get every medical school to do this, I think our residents should really, have a vested interest in this. And so I would love to see this incorporated more even in our own, core curriculum and other areas where I think this should be kind of a standard part, standard state of affairs. Even if you're not going to be the person on the Hill, you should still know about it. And I think that at least, you can figure out what ways you can be involved, whether it's passively or actively. But I think just having the knowledge is important. So I would love to see it. I mean, healthcare, of course, as you know, is changing rapidly. And so I think, certainly, updates to kind of the content are certainly going to be a real thing. But I would just love to see it penetrated a lot more through different programs, and hopefully just having everyone graduate with a confident sense of knowing how the system works and how they can help to impact the healthcare system.
Absolutely. We do have a few questions in the chat, so let me turn to those. The first one that I have here is, when you were doing this work and then you became an attending, did you negotiate your policy work into your job contract? What was the process for doing that? And what is your advice for getting buy-in from employers, grant committees, journals, et cetera, on supporting advocacy and policy work?
Yeah, a great question. I think that urology certainly has a ways to go with this. As I mentioned, there's still a ton of urologists who I think do need some, education and exposure to health policy and advocacy. I think when you think about, job searches, you have to first think about what that fit is, because of course I'm a urologist first. So I'm thinking about, I want to be able to take care of my patient in an environment that's, supportive and that cares about the, my subspecialty, right? And so I think that's key. I think that for those who are kind of actively, maybe thinking of doing this and, want to let their bosses know, I think it's important, right? Because advocacy work, it's not necessarily something you could quantify, perhaps like going to an academic conference, right? So if you're thinking about, okay, how do I quantify the time, that I took to, read over maybe a bill we want to submit, or how do I quantify the time for meeting with a patient advocacy group to kind of talk with them about how we're going to strategize to go to the state capitol and talk to, this congressperson. I think it's just, I think as medicine has progressed and people have realized all of these components of medicine outside of research, I think several hospital systems are trying to figure out a way to kind of lend credence to that work, and recognize that, yeah, you may not be writing 10 journal articles, but if you're on the Hill, I'm actually making progress with some of these advocacy efforts that deserves attention too. So I think it's important to be transparent with, your chair and your employer But I think that, certainly my first priority was being a urologist. And I think that I knew I was going to kind of figure out a way to incorporate the advocacy work with my clinical work. But I think that has to still very clearly be your first priority. But I think if this is a space you're interested in, I think there's nothing wrong with, telling your employer that this is, important work that you do. And perhaps depending on where, your hospital is, kind of seeing where you can have a symbiotic relationship. Is there something that maybe this hospital or this, particular geographic area has been trying to do? And, if you have either expertise or interest in this space, you can kind of help them do that. A lot of hospital systems are also quite involved on advocacy fronts. And so I think that it could be something where you could find maybe an unknown partnership or opportunity where you can contribute. So that would be my advice. Be transparent, kind of know where your interest lies and, be in a place that you think is supportive of it. If you feel like you're in a place that's not, may not be the right fit for you, but I think it's always best to be open and clear about what your goals are.
Definitely. That's such, a valuable insight to have. And I think, something that you mentioned is where you are. And I admittedly have, a lot to learn when it comes to state-based advocacy. And that's something that we do talk a lot about at, our AUA legislative meetings with the state advocacy committee and things like that. And, the state urologic associations and medical associations are really sort of a grassroots way to get involved in this kind of work, especially with those patients that you are seeing every day, since it is very localized. And so I think that's another great place for people to look into as they're trying to sort of find entry points into the health policy and advocacy world. Certainly something that I look forward to taking more advantage of. And I know there's, the Grass Tops program that we talked about at Health Policy Weekend and things like that. Have you been involved with the Illinois State Societies at all?
Not as much. I'm actually currently our Illinois rep to the North Central section. And so in the last year, actually, I've actually been making more of an effort to figure out kind of the local players. My congressperson is actually very involved locally and a lot of like is very present. And so I've had an opportunity to actually kind of form a budding relationship with him just to be able to think about, okay, outside of things like the advocacy summit or like a big meeting, how are we continuing this work kind of longitudinally and having these touch points? Because I think the AUA, especially with some of the Congress people that have been longtime supporters of us, when you go to the Hill, they're like, oh, yeah, the AUA. And I think just thinking about buy-in and being, co-signers for different bills and such, I think it's important for us to like just be present. And I think we certainly can continue to strategize about how do we keep that relationship going. And so it's something that I've seen illustrated kind of during my earlier attendances with the summit. But I think within the last year, I've really just been trying to be intentional about that. And also thinking about like, again, I'm in an academic center. There are certain things that are really kind of top of mind for me. I try to like stay on the pulse of what's happening in terms of health policy, but you have to also connect with people in different settings to see what their challenges are and what they care about. And that's something that I am kind of trying to do in terms of, okay, people outside of like my academic silo, just so that that voice that you, kind of pitch in terms of, okay, this is what we care about, that it's truly a unified voice and coming from different practice settings.
Yeah, definitely. I mean, as you said, there's so much work to be done in the margins, and that's often not at the big academic center, but in, more of a community-based organization. So, yeah, I definitely hear you there as someone who also is at, an academic center, but in an urban place with a wide swath of different patients from different socioeconomic and different backgrounds.
Right.
Another question in the chat here. I'm going to warn you, it's a big one. So it says that Dr. Asafuaje has an interest in value-based care. Can she talk about some of the health policy changes she hopes to see in the next 5 to 10 years in that regard?
Ooh,
Yeah,
okay, great.
we come to play here at the par.
We did. Well, I think the first thing we mentioned this, a bit more. I would love to see kind of firmer legislation around telehealth. I think that again, my subspecialty really has benefited quite a bit from telehealth services, and being able to expand that is important. I'm hoping to see some health policy changes around AI. Earlier this year, the White House kind of came out with their AI Bill of Rights, and that was kind of more of a generalized template for how we are going to protect kind of, people and Americans with AI. But that is certainly penetrating more and more in our healthcare, settings. And so I would love to see how policy kind of keeps up with the kind of rapidly expanding role of artificial intelligence. I think that considering the patients that we take care of, I would also love to see more support around research. I think that is something that, if we are going to continue to be kind of leaders in healthcare, I think we need to see research in all areas. I know we tend to be very heavy on the onc side, and I would love to see that continue. But I do think that I would love to just see kind of expanded, research support in benign urology as well, because some of those kind of quality of life issues and other things, I think sometimes may not get as much shine as some of our other kind of big and kind of on which again all are important, but just to see some diversity with kind of research, supportive funding. And then more importantly, thinking about just getting more urologists and more urologists who don't all look the same. I think it's, important as our U.S. population continues to, evolve and just be this wonderful melting pot of different, cultures, backgrounds, geographic areas, races, et cetera. I think it's important for us to think about keeping pace with what our patients are and what our society is. So I would love to continue to see also more legislative efforts around getting the best of everyone into medicine and, really, making it so that, people see this as not only an attractive specialty and subspecialty, but something where they do have a viable future. There is about, what, 4 urologists for every 100,000 Americans. We need urologists. And I think that, we need urologists who, again, kind of represent kind of the rich fabric of American culture that we treat, and that's something that I hope that we continue to expand upon. So those are some of the big health policy changes, and I think being able to kind of be a triple threat, whether it's thinking about our clinical care, thinking about access to care, thinking about the kinds of physicians that we have. I think that these are things that I know the person asked about just value, right? Like you want to go to a place that I think values everyone. You want to go to a healthcare system that you think values researching and doing things in spaces that actually affect you. And so I think it will be interesting to see how we kind of continue to judge, hospital systems and our healthcare system overall as we continue to just hopefully, be leaders in these spaces. But I do think that we just have to, we have a road still a ways to go, but I think there are different areas that combined, I think really make strong healthcare systems. And I think everyone still has a little bit of work to do.
Definitely. I mean, such important points that you made. I mean, when you run for office, sign me up. But no, I mean, I think with the value-based care, discussion in particular, the idea of combining, all the data and the research that we have in healthcare with what's actually going on the ground, and then the policy side of that to really create a system that is measuring outcomes that are more inclusive, but also sort of more data driven is really somewhere that I personally would like to see this work go. And, urology is uniquely suited in that we really don't have a medical specialty corollary, somewhat nephrology and things like that, but really we're taking care of both the medical and the surgical side of our patients. And so for that reason, we really, and that reason and the lack of urologists, as you said, we really do need to work closely with primary care physicians and things like that to bring them into our subspecialty. And there's a lot of interdisciplinary work that can be done with value-based care and clinical quality measurement and making our society guidelines more accessible and, more inclusive and things like that. And so, I think value-based care is going to be a big topic over the next 5 to 10 years, as the question asked. And it'll be, I think so important to be mindful of both the research behind it, but also who is being excluded from the research traditionally.
Exactly. And I think when you think about just like implementing all the, kind of the outputs of all the wonderful research that we do, we also have a lot of, work to do there. I think kind of when I think about what the big priority or topic it's going to be also in the next 5 to 10 years, it's data, right? This is what, billion-dollar companies are paying for. They all want our data. And I think that, as we continue to advocate for our patients and, for different priorities, we have to start with the data. And I think, for value-based care in particular, when people may be scoffing at something that we are advocating for, I think we are getting better at showing those numbers to kind of justify that. I have a particular interest in this area. I'm actually getting an informatic, I think I told you, an informatics certification now, and you just recognize how that data is kind of that link between different aspects of policy, different aspects of urology. And I think if you have those core tools to be able to present that data in a way that either your policymakers, your employers, hospital system can see and appreciate, that's what's going to continue to drive, value-based care. And I think that's increasingly what the government is going to appreciate when they are trying to determine, well, what do we think this, is this reasonable for, compensation? Is this reasonable for coverage for this patient? So I think more and more people should also hopefully, take an interest in that and how we are compiling the data. I think certainly in the era of, AI, where there's so many different ways to kind of splice things, thinking about how we are accurately compiling that data and really telling the story and visualizing it is important.
Absolutely. And, of course, it comes back to how we communicate with our patients too. Big data, AI, it's such a powerful tool, but there's also a lot of fraught history with data collection for a lot of patient populations and how we explain it to patients, how we do it in a way that, is going to tell a story, but also is, including the patients as our partners in that. And, really patient-centered care as we move towards more precision medicine, building that trust, having a dialogue and a narrative that is inclusive and, equitable, I think is going to be a big challenge as we move forward, but is so vitally important to the process as well.
Right.
I guess related to that, you, Dr. Bressler, others have been real trailblazers in the DEI efforts at the AUA and sort of the subspecialties. Can you talk a bit more about sort of what's coming down with down the pike with that and the work you've been doing on those committees?
Yeah. So I think the AOA certainly has been just tremendously supportive of our committee and continues to be. And I think that certainly even in my sexual medicine society, tremendously supportive. I think things that we are going to continue to see expand. We have our Up Squad platform, which is kind of the first virtual-based mentorship platform. And we have now over 600 members, I believe. And for those who don't know what Up Squad is, it is free for all AOA members, but it's something that we pitched. I had actually been working a little bit with this company with the Reproductive Med Society that I'm a part of. And I just thought, post-COVID, right? Everyone, knows how to kind of engage virtually, right? You know that you can do research, have a mentor. The person doesn't have to even be at your institution. And I think that it was important to think about, well, if we want people to have mentors, and if we're thinking about just getting more people into urology, I think it's important to think about you want people to still be exposed and not feel limited by just, geography. And I think that it was really great that, COVID kind of showed us that we can do different things without necessarily being in the same physical spaces. And so Up Squad, which I actually also hopefully will provide a resource for this at the end of this fireside chat, but it's an entirely free platform. I compare it, I say it's kind of like the LinkedIn for urologists, but there are different kind of pods set up by interest, including, med students. There's a place for you there. People that may be at programs without urology programs, clinical interest areas, areas of kind of, I'd say, diverse backgrounds, as well, geographic backgrounds, interests. And so I'd really encourage you, if you, one, don't know what I'm talking about or haven't been on the platform, I'd encourage you to sign up, today and just explore it. I think we've seen a lot of great kind of new mentoring relationships, research, kind of groups and other things form on the platform. And so I think we're excited, I'd say, on the UA side to see that expand. I would say on the SMSNA level, and I actually was just the outgoing chair for the DI committee at SMSNA, but we did launch a speed mentoring program there where, kind of where we're doing our conference, the local med students as well as med students and residents attending the conference have an opportunity to, engage with kind of the attendings and, different leaders, in the society with more of an exposure to sexual, medicine. But I think the idea is just that it's important for people to, I think from, backgrounds and, areas that are not necessarily dominant in our specialty to either, see people that look like them or at least to feel inspired that you can get there. I certainly think that, mentorship is something that we've been really driving home, not only with the Up Squad mentoring platform, but also just the broad idea of, how do we get more people in urology and how do we get kind of more diversity of thought and voices, in urology. I think mentorship is really at the core of that. And so I think we're, continuing to expand areas where that can happen. We have, a program at the summit as well as at AUA where students sign up to attend. It's open to, all students, but they sign up to attend. They're paired with attendings for the day. And that's been really impactful for people to, sometimes not even know, like, their mentor for the day is like the AUA president or someone who's just, kind of having them tag along. But I just think when you see yourself or when someone just even gives you, that push and really even agrees to mentor you, through this journey, it really, really goes a long way. And I think I have certainly benefited from excellent mentorship, throughout my journey. And I do the same for others as well. But I just think I try to pay it forward and it's been really impactful.
Yeah, I couldn't agree more. And, I'll give a plug. The Up Squad platform is amazing. Definitely encourage people to take a look at that. And, at this past AUA annual meeting, I met people who were going around with Dr. Ree and, my program director, and they came by the AUA PAC booth and I met them through that. And so these really are, impactful programs that will get you to meet some great people and introduce you to others. So definitely strongly encourage people to look into that. It's awesome work that you guys are doing there. Um, all right, looks like we have just a few minutes left. So I think, our final send-off question, if you had one or two sort of biggest pieces of advice, of course, the e-curriculum, these things we've talked about are great resources for people to get involved and get engaged. But any sort of final words of wisdom to give this group of, young, engaged, upcoming urologists?
Yeah. I would say, my first kind of piece of advice, be the voice you would want for yourself. I think we all, of course, are a little bit, biased because, we're in the space, we have at least, some of this education and a vast majority of people that we take care of, people in our day-to-day lives, friends, family, just don't have the privilege that we do. And I think that, we come from a privileged, position, right? Being physicians where there are certain things where it's like, you have that exposure to. But sometimes when I think about what drives me even day to day, it's, this is if I wanted someone to do this for my mom, if I wanted someone to do this, for my dad, um, what lens would I want them to come from, right? I would want them to be knowledgeable and I want them to genuinely care about, their work, right? And so I just think that in the advocacy space, no matter what area kind of, like drives you, it's just thinking about, well, if you were the recipient or the beneficiary of something that, came out of this, how would you want that person to present it? How would you want them to kind of, put their voice forward? So I think that's one thing that I would say. And, for me, of course, I'm a urologist first, and I think those experiences have really influenced what have been kind of now more narrowed areas of focus outside of, I'd say before med school, I was just kind of, thinking about the whole system. Of course, now my lens is a little different as a urologist, but I have, kept that interest, which has been really at my core since, like I said, college, and I've maintained that, So I think give yourself permission to be exposed and give yourself permission to, think about new areas of interest, right? I think a lot of us may, from fourth grade, maybe we have our dream of what we wanted to, be, finish neurology. That was not me. But I think that at the core of that, I always knew I just want to like help people lead better quality of lives. I want to be a part of that, process. But I think as I've recognized the impact of the system on that mission or that goal, that has to be important for me as well. And so I just think I have just that's been at the core of a lot of what I do. And I think it just makes it easy to balance and incorporate this into my work because I truly believe in it. And I truly think that this is how we're going to change the face of healthcare.
Amazing. Well, this has been such a wonderful talk. You mentioned mentorship, and I would be remiss if I did not just thank you so much for all the mentorship you provided to me and others in this group. You are truly an inspiration, and we cannot thank you enough for spending this evening having this fireside chat with us. Really amazing work that you're doing, and so inspirational, as I said. So thank you so much, Dr. Asafu.
Well, you're so kind, Logan. And thank you. Like I said, I will be, I'm sure, working for you one day, but I really appreciate it. I'm so very happy to have this chat. And I think for anyone who joined, we could set the course out and I'm pretty easy to, reach out to if you have more specific questions on anything we touched on tonight. Thank you, AUA, obviously, for also, hosting the fireside chat and helping us get this, together in this warm December evening. Of course, I'm in Chicago, so it's not very warm, but it's a fireside in my mind. But I appreciate everyone just attending and taking the time. But we're here to help, and the AUA has tons of resources for advocacy. So I think if anything sparked your interest and there was something we mentioned that you want to get involved in, certainly reaching out to me or even, Dr. Golansky, we'd be happy to point you in the right direction. But thank you for having me.
Absolutely. And I will give a final reminder. We'd love to see everyone at the summit this year. It's going to be March 3rd through March 5th. We do have the Public Policy Forum for medical students and residents to submit proposals or research projects and to receive, funding and things like that to attend the summit, or at least have a bit more of leverage with your program that you'll be presenting at the conference. So would love to see everyone there in March. So thank you so much, everyone. Have a great night.
Yes. All right. Good night, everyone.